Alberta Primetime with Michael Higgins.
Welcome to Alberta Primetime. Ahead tonight, our panel on pipeline politics as the Prime Minister heads for China. But first, a call for drastic action.
Now, the only people that can help us is the Premier and the government to step up and say, absolutely, this is a problem, and this is what we're going to do to address it.
Alberta physicians are urging the provincial government to declare a state of emergency, opening the door to measures that would bring down hospital wait times. In response, Alberta's minister in charge of hospitals and surgical health services says in a statement the province will continue to monitor system pressures closely, work with health system partners to respond to challenges as they arise. And joining us now, Dr. Raj Sherman, an emergency physician and a former MLA and former leader of the opposition. Dr. Sherman, sir, good to see you. It's been a while. Welcome back.
Thank you, Michael.
What is your frontline perspective on the alarm that physicians are sounding here?
Michael, first of all medical staff are doing heroic work under very difficult circumstances. Once you get into care, the care is actually excellent. The problem is getting in. Now, the ER system crisis is actually a whole healthcare system crisis that surfaces in the ER. This is the worst ER and healthcare system crisis I have seen in 35 years of working in the front lines. When demand overwhelms capacity and ability to provide care, we in the medical world call this a medical disaster. And Edmonton is there now. We serve 2.5 million people in a massively underserviced north, and Calgary is not far behind. Our hospitals have been running at 110% capacity with people in hallways upstairs, and about 25% of those beds are blocked by fragile seniors who simply need home care, rehab care. About a third of them need long-term care. We call these folks ALC, alternate level of care patients. So they block acute care beds, and that leads to almost every ER bed. Almost 100% of ER beds in Edmonton are plugged by sick, admitted patients. We're done with them, but they can't go up. They stay in our department for days, deconditioning by the hour. So the waiting rooms pack with a whole bunch of folks, some minor cases, but a lot of very ill patients, some critically ill. You know what? We've had at least one documented death, and I've heard there were 2 more at the Grey Nuns waiting for care. The whole ambulance fleet gets tied up, and they can't show up for an hour if you call 911. People suffer. So, in a wealthy province, Michael, this is unacceptable.
To what degree, though, Dr. Sherman, is this about respiratory virus season? Because we're in the thick of that now. How much of a finger can point to that as speaking to why the situation is what it is?
Michael, you got to look at the data and the facts. The system has been redlining since February. Since the end of the flu in February, and we have been redlining up until August. That's what the data shows that I shared with you. Yeah, the flu isn't helping. No, not many people are vaccinated, but the system was beyond capacity in August. 10 to 20% of people going to ERs in Edmonton were leaving without being seen, and many of them very ill patients. So the flu is just the straw that breaks the camel's back, but it's not the underlying problem here. It's a system that's been under severe strain for a long time.
Okay, let me read you this. Calls for a state of emergency are misguided and would add nothing to what is already being done. That's a statement that came from the press secretary for Adrienne LaGrange, Minister of Primary and Preventative Health Services. What do you make of how the government is responding?
Michael, a press secretary doesn't know what the heck's going on in the front lines. I think it's irresponsible of them to put that statement out. First of all, a medical state of emergency means operational medical command and control of the health system. One leader, with their team, real authority, 24/7 discharges, rapid movement of these ALC patients to restore the flow so people aren't suffering and dying in waiting rooms. They are not calling for COVID political states of emergency, which is lockdowns, mandates, and taking people's freedoms away. That's not what we're calling for. We're calling for a medical state of emergency. But for me, Michael, I don't care what you call it. Call it whatever you want. Forget the label. All that we care is the system works and flow is happening.
You recently had a taste of, there's this crossover between your involvement in the health system and then your involvement on a leadership level where the political side is concerned. The Premier appointed you to chair the board for health quality of Alberta. And that's about improving patient safety, right?
Absolutely.
You served 1 year of your 3-year term there, but you only went that 1 year. What did that open your eyes to?
Look, I knew what was going on as a frontline doctor, and I still work in the front lines part-time. When I chaired the Health Quality Council, the independent quality, safety, and data organization, we looked at the data and the facts. The data shows that the system was worsening. Like, it was really bad in February of 2025. I called the Premier. I said, man, we got major problems here, Premier. And that crisis stayed throughout the summer, and our province has grown. People are older and sicker, and then the flu hit. But we were already redlining. So this is not my opinion. It's fact. I warned the Premier back in February and through the health ministers in late summer, saying, we're going to be in major problems. You guys got to get going here, get the hospitals, get the ALC patients out ASAP. So this crisis was predictable and preventable. Solutions exist. What's missing is operational medical execution. And they don't have anybody who understands the system running it right now. It's in the hands of ministers.
What does that say to you then about leadership?
Well,
is that health leadership? Is that political leadership?
You know what? I talked to all my health leader friends. They're sort of lost. There's no leadership. We have 4 ministries running in the health system. For the first time in decades, a premier has taken 100% control of healthcare. The tentacles of politicians are in frontline delivery decision-making. I told the premier, as a premier, with 100% control comes an opportunity to do the right thing and fix it. But if you don't, you know what? Also comes with it a duty of care and responsibility to care for people, and this is going to be on you. There is going to come blame and medical and legal risk. So this is not a time for blame. It's a time to, get things flowing. So politicians got to get their hands out of politics. We need an independent authority run by a healthcare leader who understands how flow happens with their own specialized medical team, flow process engineers, maybe some forensic accountants to find out where we can deploy the resources to get the flow happening. Hey, engineers could run this health system, and you engineers understand, flow processes.
Okay, put your political hat back on, as well as being a doctor. What's the foundational fix? Who needs to take the reins here?
Well, Michael, first of all, fix is not easy. It took a long time getting here. You can't just blame one premier, one politician for this. It's a national problem, but it's more acute in Alberta. So first, the government has to acknowledge we got a major healthcare access crisis. Okay, right now from them, crickets. They're in denial. They're thinking it's just the flu. Okay? Secondly, we need to activate this emergency authority team led by a medical champion. Dr. Cowell has done this many times. Dr. John Cowell, and he's 82 years old, but he should probably mentor the next person running it. We've done this before. Let's restore flow and delay risks and harm to patients and tragedies like Mr. Sri Kumar and his poor young family that lost a father at such a young age. And then medium, long term, we got to fix the foundation of the system. Number one, we got to do what the Danish do. Deliver such good home care, long-term care, rehab and transition care, hospice care, that you know what? It's called the home first model of care. Secondly, the Europeans deliver team-based primary care, world-class primary care, and family doctors. 3, prevention. Let's get vaccinated. I'm sorry, it doesn't cause autism, and neither does Tylenol. And let's, have policies on prevention. Most importantly, staffing. We can't do this. We have staff for 4 million people, but not for 5. So let's invest in staffing, retain them, educate them, hire them all. And funding. You got to put healthcare into 3 to 5 year funding cycles. They've been starving healthcare funding because you got to account for population, growth, inflation, aging, and technology.
All right. We've gone way over. Appreciate getting your perspective on this, Dr. Sherman, as always. Thank you, sir.
Thank you, Michael. To Albertans, I have a message. This is about patient safety, not politics. I'm a conservative. I ran for the Conservative Party. To the people, to my fellow Albertan, please be patient with us in the front lines. Write to your MLA, all MLAs, and demand better of your elected representatives. To all the staff, thank you for everything that you do. Keep doing it. To all the lawmakers, I am asking for an emergency meeting of the Legislative Assembly. This is a matter of public safety and importance. And finally, to the Premier. Premier, you have the authority, the power. We're not asking you. We're begging you. Please, let's get this authority up and running, and let's fix this. We can still fix it. It's not too late.
All right. We have to leave it there. Thank you.
Thank you, Michael.